Hello, I'm Dr. Gregory Davis, gynecologist in Chico, California. Thank you for joining me today. What we're going to talk about today is hypothyroid or low thyroid symptoms. I'm sure you've looked on the internet and you've researched your symptoms and somebody has told you, well, you may have low thyroid. So let's talk about the symptoms related to low thyroid and then we'll talk about the lab testing. If we look at the symptoms, the number one symptom that most people are going to complain about is going to be weight gain. Now, we're talking about weight gain that's new to you. You've been doing well, you've not really had problems with your weight, and now all of a sudden you're having trouble maintaining your weight. It's starting to go up, you haven't changed your diet or your exercise. So it's a new change in weight gain. The other symptom is going to be fatigue. Now, this is kind of a new symptom for you. This is something that you haven't had before. And now all of a sudden you're having trouble getting up in the morning, you're having trouble making it through the day, you're drinking more coffee. So it's a new onset of fatigue. The other symptom is what we call cold intolerance. So this is a situation where you're colder than everybody else. You're the only one wearing a sweater or sweatshirt when everybody else is in shirt sleeves. The next symptom is dry skin, and we're talking about excessively dry skin, having to use lotion all the time. The next is changes in your fingernails. So your nails become very brittle. They start to crack, they start to split really easy. And then the last symptom is constipation. Now, this is a new onset of constipation. You haven't had this problem before and now all of a sudden you're starting to have this problem. So you're going to go to your provider's going to order some thyroid tests. They're going to order a TSH, they're going to order a T4, a T3, and maybe a couple other lab tests. So when you order the TSH, that is what we call thyroid stimulating hormones. So thyroid stimulating hormone is made in your brain. Now, your thyroid gland is located in your neck. Your thyroid gland has two lobes, and so I'm going to attempt to draw them. So your thyroid gland makes two hormones. It makes T4 and it makes T3. Now, these two hormones are circulating throughout your body. So they're circulating through, and especially through your brain. So as your thyroid hormone goes through your brain is monitoring the levels. And when your thyroid starts to decrease, and so your T4 and your T3 start to decrease, so these levels are going to go down, your brain steps in and goes, come on, you got to work harder. So your thyroid stimulating hormone starts to go up. So when we look at your TSH, the range is 0.45 all the way over here to 4.5. Well, that's a huge range. And here's the problem. You may get your lab tests back, and your lab tests come back over here at 3, 3.5, or 4, and your primary care provider or whoever's taking care of you and ordered the test will say, well, you know what, you're normal. And you're going, but I've got all these symptoms over here. And they go, no, you're in the normal range. Well, that's an interesting thing. Today we know that at the Mayo Clinic, their upper limits in normal are 2.5. So if you're over 2.5, they're going to treat you. My range is a little tighter. It's 0.45 to 1.0. So this is a very fine, tight window. So as your thyroid decreases, your TSH goes up. So that's not a good thing. What we're looking for is we want to see your TSH come down to here into this range. So how do we do that? We start you on some medicine called Synthroid. And Synthroid is replacing what your thyroid's not making. So your thyroid levels come back up, your TSH comes down, you start to feel good, and these symptoms start to go away. Now, here's an interesting thing. Just going to throw this in. Research just came out recently, and for patients that have depression and have low thyroid, guess what? When your TSH is down into this window, your depression gets much better, much easier to treat. So I hope this information is helpful for you as you get your thyroid testing done, and hopefully you can get balanced out and start to feel good. Thank you.